start talking about assisted reproductive technique, I would just like to give you a wide overview that infertility is a rampant problem amongst the young couples in India. It's a big social as well as psychological distress-causing event, and the aim and the desire of all such infertile couples is to have a baby of their own. And assisted reproductive technology is actually a panacea, a boon for such couples. If we just look at the entire world at a glance, we can see that almost 1 in 6 couples suffer from infertility. And out of this huge number of couples of infertility, around 10% require assisted reproductive technology, require the help of a wonderful embryologist to help them conceive. You can just see here, so there are so many things that are contributing to rising incidence of infertility, the increasing chances of having a baby can be attributed to weight loss, if they quit smoking, if husbands quit smoking, if exercise is done, if people eat healthy, and if they run labs. So these are the facts that can contribute to the management of infertility. Now with this background, I come directly to, we have students here, so I would like you to know what is assisted reproduction. Assisted reproduction is any procedure that involves the handling of both oocytes and the sperm or embryos to establish pregnancy. So whenever we handle both these gametes or the embryo, the procedure is called assisted reproduction. So what does this involve? This involves collection of gametes, fertilization, to create embryo in the lab, and transferring the embryos to the uterus. So unlike what the name indicates, we say it's a test tube baby. The baby does not grow in test tube. It is just that the fertilization and the early embryonic development takes place in the test tube, and subsequently the rest of the growth of the fetus or the embryo takes place in the mother's womb. So one very important point that we all have to keep in mind is that in treatment where only sperms are handled, like intrauterine insemination, and finally it was in 1978 that the hard work of the scientists yielded results and history was created. Then the first test tube baby, Louis Brown, was born, and it was there. We all were very small, and you were not born at that time, but I still remember having seen these pictures of the Times magazine, where the news was splashed all over, and it persisted there the news was there for almost 2-3 months. And for their wonderful effort, Edward and Patrick Steptoe, the two famous scientists who contributed mainly and immensely to the development of this technique, were given a Nobel Prize in the year 2010. See how long it took for the world to realize that these two very important scientists deserve a Nobel Prize. And now, Louis Brown herself is a mother, conceived naturally and delivered by cesarean. So, we know by now that assisted reproduction is a very, very important, a very, very viable option for the management of infertility. So I would like you to go back with the message as to when do we need assisted reproductive techniques. When do we need ART? We do not need ART in all infertile couples. We just need ART in couples where there is severe oligoasteroteratospermia, or where there is azoospermia, where there is severe tubal factor infertility and both the tubes are blocked, where there is anovulation, severe endometriosis, or unexplained infertility not responding to treatment, or when we need pre-implantation genetic diagnosis. Or nowadays, a new branch has developed where we have young women or young couples who suffer from cancer. So fertility preservation in cancer patients requires the help of, what is that? Then some The male actors are having kids by surrogacy. So you should know the difference. What is it? Now when we just talk of in vitro fertilization, we should know that it is the commonest and the most successful type of ART. And here, how does it differ from natural conception? In natural conception, the ovaries produce the ova are ovulated, picked up by the fimbria, fertilized by the sperms in the tube. Finally, the zygote develops, and in the early embryonic stage, it implants in the uterus. What happens in IVF? The ovaries are made to produce eggs. They are stimulated. Then they produce not many eggs, and these eggs are then retrieved under ultrasound guidance. And these ova are